our series of modifiers, and today we will be focusing on modifier 58 for the CPC board exam. And it's always a good habit to have your pen, pencil, or highlighter. And this is what I'm using, my purple highlighter. And we're focusing on modifier 58. Okay, modifier 58. Staged or related procedure or service by the same physician during the post-operative period. So it is staged and it is the same physician during the post-operative period. So they return into the OR. It may be a different series of surgeries that they have to do, and that's what they have to do. We'll proceed with additional services in the next procedure. So it's planned, returned to the OR. So let's say you're doing a surgery on the eye, and they're doing part 1. Now we're going on to part 2. So this is the modifier we use. Okay. All right. So let's get down a little bit more. Okay, modifier 58. A new post-operative period begins when the stage procedure is reported. So once you start a new surgery, that one has its own post-operative period. Modifier 50 is not used for stage procedures when the description of the codes include 1 or more visits or 1 or more sessions. Modifier 58 is not used when reporting treatment for a problem that requires return to the operating room. They might say, well, okay, this is part 1 of the surgery, part 2 of the surgery. Modifier 52 indicates that the procedure was planned, anticipated, was more extensive than the original procedure, or represents a therapy following a surgical procedure. Per NCCI guidelines, modifier 58 should not be used when a scout endoscopy is reported or when a laparoscopic procedure fails and it is converted to an open procedure. So here we are. These are the key points for modifier 58. And we're moving on to our question. So let's look at this. Modifier 58, and this is our little quiz. A patient presents for an insertion of a Heinemann capsules for clinical bronchotherapy. The documentation states that this is the first of 2 procedures. So let's look on the first procedure. We would use 58346, and then the second procedure we would use 58346, modifier 58. So here it is, and this is the first of 2 procedures. Okay, so it's staged. So thank you again. And as we continue on our series of modifiers, talk to you soon. And welcome to our series of CPT modifiers. And today we will be focusing on modifier 59. Always remember to have a pen, pencil, or highlighter. And this is my highlighter that I'll be using to make notes, correct mistakes, and all that good stuff. So let's begin with modifier 59. And with modifier 59 is distinct procedural service. Okay, so a lot of students get a little confused when to use modifier 59, modifier 50, and modifier 51. So let's make it easy for you guys. And I came up with all my jumping men, and look at them. Okay, here is one, here is 3 of them. Okay, so let's look at this. So modifier 59, he has a procedure here on one hand and a procedure here on the leg. Okay, look at modifier 51. He has all of the procedures in one area, multiple procedures in one area. There you go. All right, this one is distinct procedure, so it's one over here, one over here. And then modifier 50 has the same identical procedures on both sides. So look at these guys. Both sides, modifier 50, and then modifier 51, one area. And you can write these down, guys. Write them down because it's very important where the procedure is in the same area. So these little jumping men are very, very helpful. And look at modifier 59. Distinct procedure on one body part up here, one body part down here, okay? Separate procedure. So let's look closely at modifier 59. So it's different body parts in different procedures. So you see it has green and orange up here, and this one is green and purple up here. So it's different procedures during the same surgery. So they're basically doing these two surgeries on the same day, right? During the same surgery, different body parts, different procedures, okay? So that's how easy it is to learn them. All right, let's move on. Okay, modifier 59 key points. Modifier 59 is used to report distinct and separate procedures performed on the same day. Distinct and separate procedures performed on the same day. Look up here. One on the hand, one on the leg. And the different procedures the same time. When a procedure is described in the CPT code descriptor as a separate procedure but is not carried out independently or is related to other services performed on the same session, the CPT code should be reported with modifier 59. Modifier 59 should not be used when another more descriptive modifier is available. Okay, so you make sure you know when you're using your modifier 59. This can get a lot of people in trouble, so make sure you use your modifier 59 when necessary. Documentation should be specific to the distinct procedure of service clearly identified on the medical record. When appropriate, modifier 59 allows the CPT code to bypass the NCCI edits when claims are edited for unbundling. So be very careful when you're using modifier 59. Let's take a look at our quiz and look at our jumping guy here again. He has multiple procedures, two different areas, two different procedures on the same day. Okay. 6-year-old Elizabeth fell down in her driveway. She had a 3-centimeter laceration on her right arm and gravel embedded in the forearm of her left arm. There was an immediate repair of the laceration on her right arm. There was a 10 square centimeter debridement of subcutaneous tissue, epidermis and dermis on her left arm. So you notice that you have the right arm and the left arm. And this procedure was taking place here, the laceration here, right? And they did the repair, and now they did a debridement. So they did the laceration, and now they did a debridement. So it's two different procedures, right? So look at the codes. So for the right, 12032, and then you have the left, 11042 with the modifier 59. And there you have it. with Modifier 59 as we continue in our series of modifiers. Talk to you soon.